Welcome to Perspectives Online and on air from WFSU Public Media. I'm Tom Flanagan. This program pre-recorded on Tuesday, June 9th. And once again, we gather via the beloved Zoom platform in advance of the program's actual appearance on the radio and Facebook. This precludes calls and emails, but we'll try to cover the kinds of questions and concerns that you might have as you watch and listen to the presentation. Of course, over the past few weeks, there has been a decided loosening of all those restrictions that came at the outset of the coronavirus pandemic way back in March. Can you believe we're talking about that now? Restaurants and retail shops, even gyms, hair salons, barbershops, bars, they've reopened to at least some degree in the intervening weeks. And then if you get out and about, you sure see a lot more people than we did even just a month ago. But this by no means indicates that the virus is taking a vacation, even though that's something a lot of us might want to do ourselves at this juncture. For one thing, the number of new infections continues to rise. In Florida, the past several days have seen a daily tally of more than 1,000 cases, with the exception of yesterday when the number was just about 1,000, just below it. The bottom line is that people are still getting sick, and for those 65 years of age and older, thereabouts, COVID-19 still tends to be more serious and have more potentially deadly consequences than it does for many younger folks. So given that, and the serious isolation issues that many older folks were dealing with even before the disease struck, this is yet another serious issue that we need to talk about. But at the same time, the very technology that we're using to produce this very program today may provide a useful tool to keep homebound folks of any age more socially connected and involved and fulfilled. So let's talk about that today on Perspectives. Our panel for this discussion is Neil Charness, the William G. Chase Professor of Psychology and Director of the Institute for Successful Longevity at Florida State University. Neil, thank you for joining us today, and it's good to see you, sir.
Thank you, Tom. It's a pleasure to have an opportunity to be with you again.
And we also have with you Dr. Don Carr, Associate Professor of Sociology, acknowledged expert in the factors that bolster the ability of older adults to stay healthy and active. And Dr. Don, thank you for being part of the program today, too.
Thank you. It's a pleasure to be here.
Well, let's get right into it. And what is the current situation for older folks who, again, as we said at the outset, may already be just kind of recoiling from regular interaction with just about anybody because of this situation? Is this leading to, do you think, Neil, a major meltdown on the part of many older folks, or is your information that they're to a large degree taking this in stride? What are you seeing?
I guess I can talk both personally and in terms of some of the research that's coming out, including a really nice paper that should be released very soon by two other faculty who are affiliated with ISL, Martino Lucchetti and Gina Sutton, rather. And in my impression, seniors are doing a little better than perhaps we would have expected to begin with. Certainly the people I talk to, and I'm on Zoom a lot. I have a kind of a weekly Zoom with my extended family, with my parents who are 95 and 97, with my siblings and their kids and spouses, and with my kids and my grandkids. And I guess we all get on the call asking, how's everybody doing? And the answer seems to be okay. People are coping. And the research data that are starting to appear or about to appear, and I mentioned that study by two affiliates of ISL, is that if anything, older adults are not showing a huge change in their reports of loneliness over time. It's this was a short-term longitudinal study. It looked at people in January, February, before we had a sense that this pandemic was developing. at least here in the United States. Looked again in, I guess, March, at the time the president had initiated his 15 days to slow the spread campaign. And then a little later in April, sampled people again during the stay-at-home period that was in effect at most states. This was a national survey looking at people aged 18 to, I guess, 98. And what it found is that contrary to the sorts of expectations that you or I might have, older adults did not show much change in their degree of reported loneliness. In fact, if anything, although people were reporting some change from the first to the second period, not in a positive direction, as you might expect, as they were forced to stay at home. If anything, older adults were reporting a slight increase in their degree of perceived support. So if you ask someone a question like, rate, do you receive the social and emotional support that you need? They were answering in a slightly more positive way over time than were younger adults in that sample. So I was a bit surprised by that finding. And but on the other hand, as Don can point out, older adults can be quite resilient.
And Dr. Carr, that is something that kind of struck me as being counterintuitive, because you think, oh gosh, the older folks, they're already separated in so many ways from the warp and woof of society. They don't get out as much as younger people perhaps might. Although that, you don't want to make that a blanket statement, but still there's a tendency for people to kind of shelter more in place as you get older. And you would think that, oh my gosh, well, they're really hurting because they don't have, the ability just to get out and interact and mingle the way that a lot of other folks would. And what you're seeing is that they're handling this pretty darn well overall.
Yeah, I think it's, I think for some people this might seem counterintuitive, but for those of us who study aging, we know, a surprising thing. There are certain things that we get better at as we get older. And that is one of the things that's really helpful to take into consideration. And in particular, as we get older, we get better at kind of managing complicated emotional situations. We tend to be better at focusing on more positive things and kind of bringing our attention more to the more positive emotional experiences and less so to the negative. And I think that's actually served older adults well during this period. They also have experiences to draw on. I've been through difficult experiences in the past. I know that I can get through this one. It's not so scary. And younger people don't have that same level of experience most of the time to rely on. And so that can give older adults kind of a leg up in kind of managing this kind of a national crisis, I think. It's also helpful to keep in mind that older adults on average came into the pandemic with lower levels of loneliness on average compared to younger adults who actually experience higher levels of self-reported loneliness. And I think that too is helpful to keep in mind. So while we do have concerns about older adults in this situation, I think that it's helpful to realize that there's good reason why they might be doing pretty well. I suppose, another important thing to point out is not all older adults are doing well. And it's the vulnerable older adults who are in particularly precarious situations that we need to be, I think, noticing, paying attention to, and sort of making sure that they don't go from what was maybe initially a precarious situation prior to the pandemic to a really tragic situation for a variety of different reasons. And that's actually, I think, important to point out. I think oftentimes we have this sort of habit of saying those older people as though everyone over 65 is all the same. And they're really very different. The older we get, the more different we get from one another, the more different life experiences accumulate. And it's important to say, like, sort of taking the temperature on how our older adults faring. But then actually where I think gerontologists often come in is to start piecing out like the different groups of older people and the different ways that they're handling situations. And I know today we're going to talk a little bit about technology, and Neil has some really great information about that. And that's one of the particular areas that I think that, you know, certain older adults have been able to fare better than others during this period.
And that, not to use a preconception, Don, but so many, especially younger folks who are up on the newest apps and social media protocols and all that kind of thing, will sometimes look down their noses a little bit at older folks that, oh, you guys just, you can't handle this. This is our natural jam where we are. We deal with this, and you guys, do you know how to use a cell phone, Mom? Do you know how to make a call? You know, that type of, I don't want to say condescension, but sometimes you hear a little bit of that there. And Neil, is that it too, that maybe a lot of folks think that, well, older folks just wouldn't be able to handle the technological demands of whether it's a Zoom call, although we know that there can be crashes and some other challenges there. But that they're really the folks who didn't grow up with this technology may be able to use it just as effectively, if not more so, than some of their younger compadres here.
Yeah, I think we have to be really careful not to stereotype older adults. I'm a pretty tech-savvy example, and probably an example of Don's example of how much variability there is in the older population. What we've seen over at least 20 years of research in a research team I've been part of called CREATE, the Center for Research and Education on Aging and Technology Enhancement, is that older adults have an interest in learning to use technology. They may not have grown up with it. They did grow up with a technology that a lot of us take for granted today. It was called the wired telephone. That's before the cell phone, for those who have grown up and maybe never ever saw a wired telephone and just grew up with the cell phone. But that technology was something they adopted as kind of in their kind of youth, their technology for communication. And information and communication technologies are really central to our ability to be social as human beings, whether it's talking to someone face to face, as we would normally do, not during a pandemic, or as the example of today, we're talking kind of face to face via ICT, via information and communication technology. So what we've shown over the years in our group, and we do intervention research as well, is that older adults are quite willing to learn to use technology. The problems really lie mostly in poor design of technology that doesn't take into account the nature of the kind of normative changes we all undergo as we age. Changes in vision, changes in hearing, changes in psychomotor skills, being able, for instance, to manage, I'll use old-fashioned technology, a mouse, or to touch appropriately on a touch screen. And the other thing that, for the most part, the people who design these systems fail to take into account is, how do we best instruct people on how to use these systems? So we talked about a cell phone earlier. Think of the last cell phone that you bought. How big was the instruction booklet that came with it? Did it even have an instruction booklet? And so the problem is, even for people, older adults who have an interest in learning to use new technology, the instructional support and sometimes the technical support really isn't adequate. And so we've tried to focus in our research efforts at trying to find better ways to both design kind of the hardware side of the system, but more importantly, the instructional support for the system. And what we've shown recently, but we can cover this later, is that with the right instructional support, you can get people well over the age of 90 to interact successfully with technology systems, including Zoom.
Is the default, though, Neil, the ubiquitous YouTube instructional video, of which there are at least 200 or 300 for just about anything you want to do today, whether it's to use the newest Galaxy 33 and a third cell phone that just came out, or you want to repair your old Hunter ceiling fan. I mean, there is something on YouTube for just about anyone. Is that the default, or are there other mechanisms that work just as good, if not better?
Well, actually, within our Create group, we've written a book on instructional design for older adults. And video has lots of advantages. It's particularly useful if you're trying to show procedures. So where there's a step and another step, and you have to kind of watch something unfold over time. It's really, really good there. It's way better than a written document where you show a piece of a step and then another step, because you can't show the actual physical movement as someone is attempting to assemble something, for instance, or unwrap something or whatever. YouTube video is a wonderful resource, but we have to remember not all older adults today are on the internet. There's still a minority, it's a little less than a quarter of all older adults don't use the internet, are not on the internet. And whereas it's normal for most of the people probably on this call to interact daily with the internet, they'll report on a national survey, I haven't used the internet in the last year. And so if what you're relying on is the internet to get people on the internet, you have a problem. And that's where things like our senior center, which offers in-person courses to individuals to help them get up and moving, are really still essential resources for the minority of older adults today who still aren't able to easily access a YouTube video.
That brings us back, Don Carr, to the situation. If you are not on the internet and the senior center remains closed and they have migrated all of their programs onto the internet, circular argument, how do these folks get that kind of information, at least in the short haul while these facilities do remain restricted?
Well, that's a good question. I think that the main way that people get information today is from other people that they know. And I think in really, in communities where there's a lot of age integration, there's people of lots of ages living in the same environment, there's actually greater opportunity for collecting information about a variety of subjects. And there's room for leaning on neighbors for support and in-person interaction. It poses a problem right now, given the fact that we can't easily go to our neighbors. But I can say from an anecdotal perspective, I live in a neighborhood like that, where there's people of all ages. And my older neighbors are doing a very good job at figuring out creative solutions for being able to engage with one another and with people of younger ages, because they're physically able to do so. They're able to get out, take walks. They can see each other from across the street. I think the biggest challenge is the people who are not on the internet, who have relied on the senior centers for social engagement and are not physically comfortable or in a position to get out of their home. I think these are the ones we really need to be concerned about. And so these are those vulnerable older people who I think we are seeing greater, who are likely not thriving in the way that some of these surveys might show.
And Neil Charness, to your earlier point then, as still organizations like the Institute for Successful Longevity can be a very pivotal advocate really in making sure that we are not including out this part of our community that it still is not onto the internet. Just the other day, there was something I needed to do at the bank, and I thought I'll just pop in and ask, one of the helpful folks there to do it for me. And they gave me this look like, well, you could have done that on your phone. What's wrong with you? You're asking me to do something. Well, yeah, you work here, don't you? And I kind of got that little feel too, that, well, gee, you should be doing this yourself. Why are you relying on us? And I'm wondering if there are any other folks who occasionally bump into that kind of attitude.
Oh, I'm sure. And was that person at the bank, the teller that you were speaking with, young by chance?
Considerably of a younger demographic, yes.
Yeah, okay, that may be a little part of the problem. So one of the approaches that we've taken here at the Institute, particularly with that issue of trying to connect seniors back to services that have now gone online. And you gave the wonderful example of our senior center, which is just a terrific resource in our community. And ISL has worked over time, particularly with Sheila Salyer, Hella Spellman, and others at the Senior Center, to reach out to the senior community, to provide information to them, and so on. And my wife, before the pandemic, was there at least one day a week playing mahjong, sort of her new hobby that she picks up and loves to engage in. And so she was playing both with friends at homes, but also at the Senior Center at least one day a week. And so that was suddenly cut off. So what ISL decided to do, because we're a virtual institute, and so we do a lot of our communicating online. We've done this pretty well from the very beginning, 6, 7 years ago. And we're kind of brainstorming. This is with Bill Edmonds and Kelly Kindlesberger, our staff. What can we do to try to help out? Because the Senior Center is closed, and we're all using Zoom fairly successfully, and other tools, Teams, GoToMeeting, and Skype, and I think today I'm on 7 video conference meetings today. How can we help provide support to seniors who would like to start to take advantage of these online resources? So we came up with a fairly, it's not an unusual way to do it. It's called Train the Trainers. And so we decided we would approach seniors who were a little more tech savvy, put together some very clear step-by-step instructional materials on how to access Zoom, if you get an invite, how you respond to it, how you set up your own account, how to schedule a meeting once you've set up your own account. Very simple step-by-step instructions. Tried them out with some of the seniors we'd contacted, got a little feedback, modified the instructional materials. And then, we worked with the Faculty and Friends Club at Florida State University, and they distributed our request. Can some people help out? Got some volunteers and trained them up, and then got in touch with the Senior Center saying, we've got some people who can help other seniors get online, and away we go. We put our instruction set up on our website. It's there. If you go to isl.fsu.edu, on the very front page in the news item, there's a link to what we think are a really easy to use set of instructions. And then actually, after we got a little publicity from our local newspaper, the Democrat, I was contacted by one of the members of our IT department, who has been the Zoom specialist at FSU. In fact, I met him for the very first time when I sort of snuck onto an early Zoom training session for IT people. Our department sysadmin said, hey, Neil, you like this sort of stuff. Why don't you sit in on a Zoom training session? And so Hans Meyer contacted me out of the blue and said, I'd like to help. And so he's been working with the Senior Center. He's put together exactly what you wanted, YouTube videos. And so, I got an email from him, I guess, yesterday or 2 days, I guess it was yesterday, or maybe a little earlier than that, maybe it was last week, showing some new videos he'd assembled to help people. So I think the story is, if you make use of, as Dawn was pointing out, the mix of people in our community who can work with seniors who are less tech savvy, and the reason we chose seniors is, of course, they're going to be a little more sympathetic than maybe the very junior people will say, who might turn to you and say, well, you should know how to do that on your smartphone. I think it's working out to help people, particularly seniors, make use of some of these wonderful tools that can be an important force against the sort of negative impact of social isolation.
And Dr. Carr, that is something that is going to only become more widespread as demography moves in that direction. More and more active seniors will be living at home, but you also have some who are transitioning into assisted living facilities and all that. And still, that does not have to be, you know, a geriatric form of prison. That can also be an opportunity for seniors to remain engaged and involved and connected through this technology, even in those sorts of settings too, isn't it?
Yes, absolutely. I think that, you know, this particular pandemic, as challenging as it has been, because of people like Neil and his group who've been sort of encouraging older people to basically be uncomfortable and try out technology because they need to. I think it's going to make it a much more useful tool for cohorts of people today who are in those age groups, who are in the phases where they might need more assistance and maybe are less capable, even in a normal period in history, with socially engaging with other people. And I think there's room for this to, you know, have a bright side in some respects. So, you know, oftentimes when people enter institutions, there are definitely assisted livings and nursing homes that are quite encouraging of social engagement and activities that are fun and engaging. But oftentimes still, you know, especially during this pandemic, there's been so many stories where people are in situations where they can't see their family members. And this has provided at least some help in helping maintain those social connections. And I think that over time, this might become a useful tool.
Connection with family and friends certainly is critical. We've been talking about that. But Neil, you also literally wrote the book on maintaining connections with the healthcare providers as well, if I am not mistaken. And we have seen that in the age of COVID-19, where more and more doctor appointments are now being done through telemedicine. So enlighten us on what your book was all about there as you were mapping out. This is, if not the wave of the future, this is certainly going to be a more pervasive part of that future than what we've seen in the past.
Yeah, and you know, it was sort of the redheaded stepchild in medicine in some sense for a while, and very slow to be picked up. And it was really interesting. I noticed an editorial in the Journal of Telemedicine and Telehealth a couple of days ago, or not a couple of days ago, I guess it was last month, that kind of said, okay, finally we've arrived. People are starting, or actually physicians have been forced to use telemedicine as the way to deal remotely with, safely with their patients, with their customers, so to speak. Yeah, sorry, did you have something there?
No, I was,
okay.
and
yeah,
now with
so yeah, you know, we've been talking for a while. Certainly in our book, we talked about how better to design those systems to be usable. Because take a typical telemedicine session, which might be you meeting with your physician, and so you're at home with whatever technology you have. It might be a smartphone, and you may have an app for that, or maybe you haven't learned to use that app, and so you're still working, as I am today, on a desktop computer right now, although right next to me is a laptop computer. And so you're trying to connect with your physician. And so we've got a situation where the technology has to be friendly to both a sophisticated professional, so they can do what they have to do, and with a perhaps less sophisticated patient population. And so, yeah, one of the really good things that happened early on, I hate to say that there are good things about the pandemic, but one of the problems with telehealth and telemedicine is it was very hard to get reimbursement. I hate to bring up money, but people are only going to adopt a tool if it's useful to them and makes them more efficient, and they can get reimbursed for it. And so Congress basically allowed everybody to kind of start to indulge in using these types of telehealth technologies, particularly meeting with your physician that way. And so, and where it's been extremely important, Dawn raised, and you raised the question about people who are in assisted living or nursing home care. I was talking again with Paul Katz, who's the department chair in geriatrics, also an ISL affiliate. And he was describing some of the, early on, the difficulties in carrying out these types of telehealth visits remotely, and how much more stressful they were, and the sorts of things he misses about being able to be with a patient, to physically lay hands on the patient, to touch, to hear, and be a careful observer of the patient in their context. Whereas with a camera, you can't see the mess in the room behind me, right? Okay, so it isn't that bad. But so telehealth, telemedicine in particular, has really kind of come into its own for a variety of good reasons. But there are still barriers there. Barriers in terms of learning how to use the systems, both on the part of the professional, but also on the part of the patient, the client in this case. So there's going to be a long, slow process of everybody getting accustomed to it. But believe me, those of us who've been sitting in waiting rooms for an hour or 2 hours, who can now go about their business at home and then strike up the conversation when they're ready with their healthcare professional, I think that may turn out to be a fairly popular way in the future for lots of us, young and old alike, to interact with the healthcare system.
I'd like to expand on that for just a moment here, but before we do that, a reminder that if you miss all or part of a Perspectives program, it's available online, not only on our WFSU.org website, but also our WFSU Public Media Facebook page, which is where you can watch this starting this Thursday. We try to have the most recent program up on both places as soon as we can after it actually airs and appears on Facebook. And you can see the program or listen to it whenever you want. Talking to Neil Charness, the William G. Chase Professor of Psychology and Director of the Institute for Successful Longevity at Florida State University, and Dr. Don Carr, Associate Professor of Sociology and an expert in a number of things, including something that we'll bounce off of with our discussion we had with Neil on the telemedicine aspect. When we get into the mental health component of that, Don, I have seen that a number of organizations, including NAMI Tallahassee, has now migrated a lot of group sessions, individual counseling sessions, that into also an online situation. So it's not just physical kinds of healthcare, but also mental health, as psychological counseling, all that has moved into that realm as well.
Absolutely. And it's probably one of the best uses for this sort of platform, I think, because, in a situation where, we need to communicate with a professional, mental health professionals are well situated, because the conversation, while it's better in an in-person environment, it's perfectly well suited for online discussion. Through a computer, we can have, in a really high quality platform, the ability to have meaningful conversations. I think one of the things that's probably inhibited effective telemedicine in the past is that a lot of times it was sort of glitchy. And when you're having an in-depth discussion and dealing with mental health issues, you can't have a platform that isn't effective. And I think that's actually where this pandemic has really pushed things forward. It's really provided improvements in the quality of using these kinds of online platforms for addressing mental health in a way that's allowed people to connect more effectively. Groups can meet online more effectively. It was always very difficult for people to have discussions. I think just by the very nature of being forced to do it a lot, I think that we've learned new etiquette, in terms of how do we have conversations? How do we have an interview on Zoom and do it extremely well and effectively? I think we've actually learned new skills as, individually and sort of collectively, on how to leverage these platforms in ways that are extremely beneficial. And I think given the biggest concerns of the social isolation and the sort of, physical distancing that we've had from one another for a period of time. And for some of us, these individuals who are at higher risk, is going to continue for quite some time. I think that having mental health professionals available in this format is a huge resource. So it has been a benefit that might even go beyond this time period.
Even as a stress reducer, because in a situation like the pandemic, where there is the fear that if I go out, if I have an unfortunate encounter, that could potentially have some really serious consequences. Whereas this way, I can go to the doctor. If I need groceries or medication, I can order them online. They can be drop shipped to the house. I don't have to go into a dangerous circumstance. I can stay in my little nest, in my little womb at the house and have just about everything done. Whereas 15, 20 years ago, this would not be possible at all.
Absolutely. Yeah. I think it's really, it's just the timing has been, I think and I don't say it's the perfect timing because there's nothing about this that's perfect that we're going through. But I do think that we are lucky that it's happening now and not 15 years ago or 20 years ago, because there is greater access to tools that we can use to continue to be quite functional. And for older people who do need to and really should be staying in their home for an extended period of time, and they should be, there's good reason to continue for people who are in higher risk situations to keep staying at home. And it's hard, but certainly these tools that we have available are making it possible. And for older people with health problems, being able to meet with your doctor just to check in, this could be life-saving in many ways, to know when it is worth that risk, to be able to say, okay, it is time to go see a professional in person right now because we've reached that point. So I think that there's a lot of opportunities that we have now that we couldn't have had previously in dealing with this situation.
Perhaps the most amazing thing being that we are talking essentially about 3 months in which all of this came to pass. It seems like it was years ago that this first struck. It has been a little blip in time. Neil, you think about this stuff all the time, and going forward with the degree of development in these tools that we've seen just over that slightly more than 90-day period, where are we going with this? What do you think the potential is as we move on down the road?
Yeah, it's really hard to predict take Zoom as an example, as a platform, what we're using today. A decade ago, that company didn't exist. And so it's just amazing how having the right tool at the right time, and if you look into Zoom as a tool, I guess the CEO who put this company together, there were already other platforms out there. Google had their platform, Microsoft had their platform, Amazon, I guess, Apple, every big tech company had some video conferencing software. Zoom was aimed at trying to simplify things as much as possible. And so they caught on like wildfire and have, I don't know, tens of millions or maybe 100 million people a day logging on to their application. So there's got to be kind of a nexus out there of good infrastructure. So today, all of us have, or not all of us, many of us have smartphones. You can Zoom on your smartphone. You can Skype on your smartphone. You can FaceTime on your smartphone and so on. So we've got the communication infrastructure in place. The other thing that happened, of course, is bandwidth exploded over the past 5 to 10 years. So a lot of people, I think it's maybe 80% of the US population now has high bandwidth internet connections, which weren't there. I think back to the days when I used to take a telephone receiver, wired telephone, stick it onto this modem, hear the little blips and beeps and hisses and so on as it tried to connect, and got a full 20 kilobytes connection, which was super fast back in those days. And now most of us are sitting on, at least, well, I guess what people call broadband today is defined by by communications infrastructure as at least 4 megabytes, not kilobytes per second. And so, and it's gotten up, a lot of people have 100 megabit per second types of connections. So we've got the infrastructure in place to be able to have these really enriching experiences available to us. I'll give you one other example that's starting to be used. For instance, we talked about therapy for dealing with anxiety, and that's thinking about 3D types of technologies like VR, virtual reality. And we've done some research in our labs, my colleague Wally Boot in particular, with some of his students, looking at seniors' acceptance of VR and AR, augmented reality. Today it's called XR as a general term, as a way to transport yourself. Say you are socially isolated, or at least you're stuck at home. You're dying to get out, but you might be in an environment like New York City, where there's not much to get out to, we'll say, immediately in your block, or it may be unsafe or dangerous. And you could put on a headset and literally be transported into a very enticing, relaxing, fascinating environment that you can literally walk around in. And so that's another opportunity as kind of a stress reliever, or as a brief escape from reality, perhaps, the reality of your current situation, that may be very functional for some people. And so that soon, that has dedicated hardware. Well, I've got a VR headset sitting out to my left here that, is portable in the sense I can stick it on my head. It doesn't have any wires and I can walk around a little bit. You have to be careful with these things. But that is kind of another interesting piece of technology that may be starting to come into its own as a way for people to have a very enriched type of environment. And then where people are now trying to use it is, instead of having this kind of flat screen VR environment, imagine sticking on a headset.
And I think we had a technological freeze. Don, we'll let you follow up here till Neil rejoins us again.
Where you
there
have
we go.
ways in which you could use that technology to enhance our experience. Where it's going, really hard to predict, but it certainly is exciting.
And again, we will have increased bandwidth so that these little freezes and glitches will become less and less noticeable as time goes on. Don, most of us, as we contemplate if there will be a retirement for many of us, would like to get out and do some traveling. It sounds like that this virtual kind of world exploration is a viable alternative, certainly to hopping in the RV or what other mode of transportation you may have and actually taking a trip.
Yes, I think that will be an interesting thing to consider. There will be more options with technology to be able to enrich our lives, I think, in lots of contexts. Although I think if you ask most people if they have the choice of putting on a VR headset or getting in a car and taking a road trip and seeing something in person, I think most people would choose that. But the nice thing is that in the absence of having that opportunity, we have the ability to engage in activities that we normally wouldn't have access to during this time. And I, from a personal perspective, would say that I'm never probably would have been as open-minded about utilizing the technologies that I've used over this pandemic in the past, if I hadn't been in a position where it's been such an incredibly important tool for me professionally and personally. So I think we've gained a lot of new knowledge in these last few months that I think we're going to be able to continue using moving forward.
Well, let you play futurist too on that score, and then back to you, Dr. Neil. We got all of these developments coming on. You will have cohorts of ever more savvy manipulators of this technology, though, coming into the pipeline as time goes on. So will this truly be, do you think, a golden age for those who finally hang up work? And more people are working longer than ever before. But when you get to the point where you say, hey, I am going to take off some additional time, and to have these sorts of mechanisms, these kinds of devices that can do so much.
Yeah, they're great tools, and I think Dawn made a good point about her experiences. I'll say she's a little younger than I am, with getting accommodated to new tools that have been released fairly recently. Um, I can talk about my wife as well. I mentioned she loves Mahjong. She's now playing Mahjong online. People told her about this a long time ago, but she'd much prefer to get in her car, as Dawn points out, drive out to a game and be physically present with other people. But that's no longer possible. She's a senior, much like myself, at risk. And Mahjong is very upfront and close. You've got these tiles. Everybody's handling the same tiles. It's probably the least safe from the perspective of promoting infection of any type of pastime I can think of, in terms of multiple people handling all these things all the time simultaneously. But she's online now. And so she's learned new things. She's excited about the fact she's able to learn new things. And so that'll be an option for her. I'm sure, hopefully once the pandemic ends, or at least we've got a vaccine or an effective treatment for people, I'm sure everybody will want to go back to our face-to-face and our normal social interactions. But until then, these tools are just providing enormous opportunity to particularly seniors who are the most at risk, as everybody has kind of pointed out, to the negative consequences of COVID-19.
See, we used to worry about all of these young people spending all this time online with World of Warcraft and those things. Now we have these roving online band of Mahjong aficionados. What's going to be next? I tell you. Folks, we only have about 5 minutes remaining in the program, so let's start with you, Dr. Dawn Carr, and give us kind of your synopsis of, number one, what the Institute for Successful Longevity at Florida State University is offering, and how people can connect with that if they would like to find out all of the service offerings that you have there to make the golden years even more bright and shiny than they might otherwise be.
Well, I actually think Neil might have more to say about that than I do, but I can say that one of the great benefits I've had in being involved in the Institute for Successful Longevity is that there are a lot of researchers at Florida State who are able to connect and build knowledge, important knowledge about aging and how to live well and live healthy. And we're conducting a variety of research studies, and we're very lucky that so many seniors in Tallahassee have agreed to participate in many of our studies. It's actually, I think, a very exciting thing to be able to do, is to help researchers with their research to better understand these kinds of issues, and how to understand how technology can be expanded and in the lives of older people. We're doing a lot of work, I think, that has helped bring some public attention to issues related to aging. Many of us who do this type of research have been very lucky to have a chance to help bring awareness to ways to help people stay healthy and active, and to have more meaningful later life experiences. So I think that's probably, from my perspective, one of the most important contributions that we have in Tallahassee, is we have these great opportunities to continue to bring information to people and share that information, and to help people have new tools and new resources to live well in later life.
And if folks who are watching or listening there, can they still plug into the research that you're doing? Are you looking for more subjects, Dawn?
Well, actually, Neil, it might be good for you to take the reins there.
Yeah, we've got about 2,700 volunteers signed up, and if you go to the www.isl.fsu, Florida State University.edu, you can find lots of resources there, including examples of presentations that distinguished speakers have made. Some of those are up on our website, including being able to volunteer for the sorts of research projects that Dawn just mentioned, and of course to access resources like our instructions on how to get onto Zoom. Had a conversation earlier today with someone saying, I wish I could get my 83-year-old mother onto Zoom. I said, boy, have I got a resource for you. Just go to isl.fsu.edu, and there's a link right there on that first page to our instructions. So yeah, we have a lot there, I think, that the community can take advantage of. We're very appreciative, as Dawn mentioned, to our community of volunteers who are helping with research projects, literally as we speak. And we hope to continue to provide opportunities for seniors to take advantage of the new tools and the new opportunities that technology is making available to us.
We also want to thank you folks and everyone who's involved with the Institute for Successful Longevity. What a terrific resource to have in our community to provide all of these different kinds of the multitudinous ways of having a longer, more fulfilling, happier life with a lot more things to do than any of us could have imagined just a few short years ago, or at this point, a few short months ago.
Yeah, well, it seems like years now, I think, Tom. I've been certainly quarantined since early March when I came back from a trip with a cold. So,
oh
yeah,
my gosh.
I've been at home a long time.
We are so glad, though, Neil Charness and Don Carr, that you guys are healthy and happy and continuing to do great work at Florida State University with the Institute for Successful Longevity. Thank you both for being part of a really interesting perspectives today, and we hope to talk to you guys again soon. Thanks so much.
Thanks,
Thank
Tom.
you.
Perspectives produced by WFSU Public Media in Tallahassee. Thanks going out to Evan Rossi today, Paul Dam, Amy Diaz de la Villegas, Tricia Moynihan, Lydell Rawls, and also Kim Kelling for getting everything put together for this program week after week. And I'm Tom Flanagan. We invite you back again next week for more thought-provoking conversation right here on Perspectives from WFSU Public Media. Take care.